Hello everybody, Dr. Chris Shaver, GI Show, coming at you with a COVID-19 and the gut follow-up. What we're learning as time elapses is that COVID-19, which is the SARS-CoV-2 virus causing the COVID-19 disease, obviously is a disease that damages the lungs and causes, in a minority of cases, severe lung disease, including respiratory failure and, unfortunately, death. We do see GI manifestations of this disease, specifically diarrhea, abdominal pain, nausea, anorexia. Those are sort of the sine qua non gut symptoms. I derived a lot of this information from the American Journal of Gastroenterology, specifically Brennan Spiegel's YouTube discussions about some of this data. So I want to give a shout out to him for sharing and educating me on some of this information. So how does the virus get into the gut? Well, we've learned that the portal of entry for COVID is what we call the ACE2 receptor. That's what the virus will lock into and get into the body. And so obviously ACE2 receptors are in the respiratory tree, but they're also saturating the gastrointestinal tract. So what we're beginning to understand is the virus can enter via the gut and presumably cause injury or damage to the lining of the gastrointestinal system, thus accounting for some of these symptoms that we're seeing, symptoms of gastritis, symptoms of enteritis, and colitis. There was a case report that came out this week, earlier, from the University of Michigan, where they had a case of hemorrhagic colitis in a patient that had traveled to North Africa and was on a cruise ship, was exposed, came back stateside, presented with bloody diarrhea and anemia, and that's why they were admitted. And the workup led to a diagnosis of a hemorrhagic colitis by flexible sigmoidoscopy. And the patient went on to manifest pulmonary symptoms, short of breath, was treated, did well. But this was really the first reported case of a hemorrhagic intestinal infection related to COVID-19. So I thought that was really interesting and wanted to bring that to your attention. Acute cholestatic hepatitis has been reported. So a severe case of liver inflammation, and the patient presented with jaundice. So again, as you might expect, a novel virus that is new on the scene, we're beginning to see sort of the myriad ways that it expresses itself in the host. Potential complications of COVID-19 of the gut. It could potentially flare a patient with inflammatory bowel disease, so Crohn's disease or ulcerative colitis. You may see a flaring of that disease. We may also start to see a surge of post-infectious irritable bowel syndrome that can lead to lingering symptoms even after the acute infection has cleared the body. So that happens in about 10% of patients with an acute infectious diarrhea anyway. So it remains to be seen whether COVID will cause a similar type of post-infectious irritable bowel syndrome. Keep in mind that most cases of diarrhea that are happening now are not going to be related to this virus. Common things occur commonly. Other viral infections, bacterial infections, food intolerances, IBS are still going to be there. So don't get too alarmed if you develop diarrhea, and it doesn't mean that you have developed COVID-19. So anyway, that's your kind of COVID-19 in the gut update from the GI Show. Stay well, be safe, and from the shadow of Vulcan, even in the midst of COVID-19 gut disease, stay regular.